Hello YouTube dental researchers, Dr. David McFadden here again from the Dental Implant Center in Dallas, Texas. Today's topic is, when can you save your teeth? I know that's a burning issue for many of you because many of you think that some of your teeth are good, but not all. There's many different scenarios that we want to talk about in this dynamic because it's a complex one. Save teeth, get dental implants, or maybe do both. And if you've landed on this video, I know that you're interested in possibly saving your teeth. So you've come to the right place. I hope I don't confuse you anymore today because, like I said, it is complicated. There's a lot of factors that go into it. But I think towards the end, I can break it down for you in a way that will help you make a good solid decision. So, who can save their teeth? What factors to be considered? Which offices won't be biased? And finally, where's the tipping point for your mouth? I'll answer all these questions for you in varying degrees as we go through this. Now, I want to touch on three different approaches to this topic. The emotional one, the philosophical one, and even a mathematical one. This will be at the end and it'll help some of you who want to go a little bit further with self-diagnosis. So let's start with the emotional one first. It's funny how this topic is separated into two different camps. Some people have terrible, terrible teeth that have a hopeless prognosis, but patients think they can still be saved. Then other patients actually have good teeth that they don't think can be saved. So the spectrum is wide, but that's always surprising to me, is that some people think that a bad tooth is a good tooth and vice versa. So anyway, philosophical and mathematical. So we see patients, literally I see dozens of patients a month who come in varying states of dental decline. We have people who have worn their teeth down from grinding and clenching. We've got people who just haven't taken good care of their teeth, everything in between. And these pictures in particular, it's a very funny story. 10 or so years ago, we were having a staff meeting in our reception area. And this nice, couple, probably in their mid-50s, came in, maybe even a little bit older, mid-50s to mid-60s. They came into the office unannounced, unscheduled, and we were all sitting in the waiting room, so it was kind of a funny entrance for them. I think I said to them, "We've been waiting for you." But anyway, they said, "Oh yes, we're here to get full mouth implant treatment." I was like, "Well, you came to the right place." So we rescheduled them a week later. Both the husband and the wife came in for new patient exams. Wife, husband. So I looked at him, I said, maybe you're confused about what full mouth dental implant treatment is. And we talked and walked through it. I said, neither one of you are candidates for that treatment in any way, shape, or form. The wife had a nearly virgin dentition. Maybe, as I recall, she might have had one crown here. The husband had really nice teeth too. He just happened to have a little bit more dental work. But I can tell by the look of these crowns that these were made decades ago. So neither one of these people fall into a periodontally distressed situation or a decay situation. So I was flabbergasted. So I said to them, if what you want is a prettier smile, then we can do that with veneers, maybe even just bleaching. Down here we can do veneers and we can replace your crowns. I can give you the prettiest smile you've ever imagined. And they were actually agitated with me. They were irritated that I wouldn't agree to take all their teeth out and put implants in. So they never came back, to say the least. But that's how weird. I guess you've heard of body dysmorphia. Maybe this is tooth dysmorphia. So this doesn't happen a lot, but I always remembered this couple because it was such a bizarre incident. So anyway, like I said, we see dozens of patients a month in varying degrees of decline. So could this patient save their teeth? Yeah, probably. Could this patient save their teeth? No. Here again, most of the teeth in this patient's mouth are good. Most of the teeth in this, I'd say 50-50. So again, I know that all of you are going to fall on this spectrum somewhere between perfect and an abomination of a dental situation. So there's a lot of factors that go into it. Let's jump right into it. So what are the main considerations for people who might be able to keep their teeth? How old are you? if you're in your 30s and you already have terrible teeth, the chances of you keeping them the rest of your life are literally zero. But if you're in your 70s and your teeth are pretty good, then absolutely. So age does play a factor in ways that I'm not going to get into today, but the basics of it, the condition of your current teeth. Are they mutilated? Are they decayed? Have you lost bone? What are your teeth? What are they like today? Number of risk factors. We're going to get into that a little bit more, and you'd be surprised about how much of a role saliva plays in the longevity of teeth. What's your level of motivation? Something brought you to this point in your dental life, your dental career. Was it poor home care? Maybe your parents didn't care about dental care when you were young. But whatever it was that brought you to this point, are you willing to make changes, lifestyle changes that can reverse some of the things that maybe brought you to this point? And cost. We always try to include cost in our conversation as often as we can because it plays a pretty big factor. I'll touch on that in more detail in just a minute. So, specific to dental condition, the status of your existing teeth. Are they hopeless? Are they good? Are they great? Number of missing teeth. Are you missing a few teeth? Half your teeth? Most of your teeth? The location of the existing teeth actually makes it's as important as how many you have. If you've got a few front teeth that are pretty good, we can usually work around those. But if you've got a good tooth here and a good tooth here and a good tooth here, they're not really in a position that optimizes your opportunity to keep teeth or to consider full mouth implants. The extent of cavities. Do most of your teeth have cavities? We'll talk about the saliva here in just a minute. Your periodontal status, how much bone have you lost? People can go with bone loss for decades, but the downside to that is that every year you're losing more of that precious bone that we need for implants. So the periodontal status has a lot to do with that decision. And finally, one of the best quotes I've ever heard in dentistry, I was at a lecture many years ago, and the lecturer came out, and his first statement was, "Our goal as dentists is to make the tooth fail at the slowest possible rate." And that was brilliant. So we do gauge a tooth's prognosis or a tooth's longevity on how much work is there and the quality of the work as well, because really good dentistry can last for decades. Really bad dentistry, you're lucky to have it last 3 years. So then we have dental risk factors. How has your home care been? Are you just one of those unfortunate people that brush and floss like a maniac, but you still have dental problems? That's rare. Most of the time people end up at this tipping point in their dental life where they haven't taken care of their teeth. What's your level of motivation? I mentioned this already. Can you or will you make the changes necessary to put yourself in a position to save your teeth and to hope for a long-term positive outcome? Are you on a caries-prone diet? I mean, everything in America has sugar in it now. Are you brushing often enough versus your caries exposure? Most people aren't. The studies have shown you have about 15 minutes after a food or sugar exposure to brush your teeth where there's no damage taking place at all. Do you grind your teeth or do you clench your teeth? Do you have dry mouth or are you on medications that give you dry mouth? How many root canals have you had in the past? That's another big indicator. Root canals are usually not a forever thing. And are you a smoker and how heavily? So those are these are not a comprehensive list, but these are the big players in our decision making. So who can save their teeth? Let's assume the person is in good health. They have minimal to no caries. They have normal saliva. And here's where I want to expand on that a little bit more. Saliva in its normal volume and viscosity are very helpful in preventing cavities. It's washing away of food debris and sugar away from your teeth normally is the number one thing that prevents cavities. You've probably heard of people, you may even have relatives, where they don't even brush their teeth and they don't get cavities. So there's a few things that go into that, but salivary volume and viscosity. If you lose volume or your viscosity goes from watery to any amount thicker than watery, that's the beginning of a problem with cavity formation. Is your periodontal status good? Do you have good bone? Do you have good soft tissues? Do you have a majority of your teeth? Are you highly motivated? And will you be compliant? Compliance is a huge part of this. We beg our patients to wear mouth guards after we finish any expensive treatment, any treatment at all, whether it's expensive or not. That is the cheapest insurance policy that you can purchase for your long-term health. And we actually give away our night guards to our patients who have full mouth reconstructions. And it's that important. Most people are in denial about their grinding or clenching habit, and that does not go away when you change the teeth from natural teeth to implants or any combination thereof. Grinders pretty much grind their whole life. It never stops. So will you be compliant about wearing your night guard? Will you be compliant about using a water pick, flossing, whatever it is that we ask you to do? What do you think the chances of your compliance will be? I know they say that hope springs eternal, or optimism is what keeps us going. And it's real easy to be optimistic when you're at this point of like, well, maybe I can save a little money and keep my teeth, or maybe emotionally I want to keep my teeth. We've all been there. Like diets are a perfect example of that. The gyms are full January 2nd and they're empty by February 2nd. It's that hope or that optimism that is kind of a false sense of security for humans. And finally, money. I'm going to touch on it now and we'll touch on it a little bit later. Let's say that all these factors line up pretty favorably. When we save teeth, and I've been doing this for so many decades now that I've flipped my approach to keeping teeth. I definitely like to keep healthy teeth when we can. But many, many years ago, we used to say this: a bad tooth is still better than a good implant. We don't say that anymore. Implants can't decay. They don't get dental caries. So I don't believe that a bad tooth is better than a good implant anymore. And quite the contrary, if we're at that tipping point where the patient and I are not sure about which way we'll go, almost always we end up taking out more teeth or all the teeth rather than trying to save a few here or there. And the reason for that is I've followed so many of my full mouth patients over the last 30 years that within 10 years, most of the teeth we tried to keep are ready to come out. They're either broken, decayed, or they've got a failed root canal. But, and we'll get into this a little bit more, but money does play a factor, and I think that's obvious to all of you. So this lecture would not be complete without me talking about dentist bias. Let's just go through a list here. If you find an all-on-4 office, guess what you're going to get recommended, right? You're going to be recommended an all-on-4. If you go to a surgeon before you see a prosthodontist, you're most likely going to get more surgery and less tooth saving. General dentistry, even by the term itself, it is designed for general dentistry. It's not it's not a specialty that deals with complex dental issues. It's general dentistry. It's named that for a reason. So what happens in these offices is if the office does implants, you might get offered some implants. If they don't do implants, you probably won't get offered implants. So you're not going to get a fair assessment of your teeth. They're going to lean or be biased towards what they do the most and how they make their money. So the specialty of prosthodontics or a prosthodontist, we are one of the many specialties in dentistry, but the only one that deals with saving or replacing failing teeth in adults. So we are the specialty where you could go and get a comprehensive treatment plan that includes multiple options at multiple price points, multiple levels of conservativeness or aggressiveness, depending on how you're wired or how we evaluate your mouth. So that is something that shouldn't go without saying, because the problem is we're not known. 2% of the population knows we exist. So now you're adding to that 2%. Maybe it's 2.01% today. Go to websites and you can start to get an idea, but by the way the website is set up. Go to their gallery. Do you see cases where they've got a mix of implants and teeth? And if you don't, it's going to either be mostly tooth cases or mostly implant cases, but not those mixed cases that are literally some of the hardest we do. And then you can ask the receptionist when you call. You can survey the doctor when you see him. But rather than taking a lot of like shots in the dark trying to find the right office, I think you should do more front-end research and less getting free consultations so that you're really, really educated when you go in and you feel like you know that practice before you get there. So here I want to show you 2 quick cases to demonstrate what's possible when people come in with good or relatively good teeth. So here's a patient who came in. She was referred to me by a general dentist here in town, and she had 2 failing front teeth, failed root canals. So you look at her mouth. She's had some grinding issues. This is wear from grinding. She's had some tissue recession, but in general, her mouth is pretty good. It's even got gold foil, which hasn't been done for 30 years, gold onlays, crowns, metal crown. She's got a variety of everything. And then you look at her x-ray, she's got really good bone around all her teeth, a couple other root canals. So she wanted to save her teeth, but she wanted a better smile from what she started with. So we simply went in and treated her for the 2 front teeth and then did veneers or replaced crowns in her smile field. So that's what she looks like. So she got 2 front implants. I'm not suggesting that every office would have offered to overtreat her, but many of them certainly would. Case number 2, we save the teeth again. I have a patient who comes in with 12 front teeth, 6 upper and 6 lower. But look at how beautiful the bone and the gum tissues are. She also is a pretty severe grinder. You can see how flat these teeth are here. And her desire was to keep the teeth. Now, a patient like this, she's the one that would almost always be talked out of these teeth at an all-on-4 office. But we'll get into the money part and the time part here in just a minute. But I see no reason to not give these teeth a chance. So we do. She unfortunately had been somewhere else and had a very bad dental implant surgery. We had to take out all the implants except these 2. But as you can see here, we went back and treated her with new implants, the 2 she had, and we gave her back teeth. So she had her own front teeth, but all her back teeth were implants. Because of all the bone loss and failed surgery, her teeth are very, very long. That doesn't show when she smiles. But now it's up to her to be compliant. She has to wear her night guard when she sleeps. And I say that kind of tongue-in-cheek because you can see here that she's now had a few more implants done because she won't wear her night guard. So when I talk about compliance, I mean you have to do what the doctor says for the best outcome. So slowly over the course of a few years, she broke off her canine teeth, and those are the ones that hit the first when you grind your teeth. So those are broken off, and we've extracted those and placed implants. So that's the part about the money that I want to just touch on here, and I'll reiterate it later. One of the philosophical discussions I have with every patient who's in a tweener that could keep teeth, but we're trying to figure out if it's in their best interest. I tell them, think about it this way. You spend tens of thousands of dollars today. Some of these teeth that we saved start breaking or start getting cavities or they fail on you. And let's use 3 years as a minimum amount of time for the longevity of that restoration. How much remorse and how much anger are you going to have about spending money and having to replace it down the road? We have patients who come in where money's not an issue, where they're like, I want to save my teeth, and I understand if they only last a year or 2, fine, I can afford to do it again. But for most of you have a one-time shot at this. And I say this in so many of my other videos. It's the first, second, or third largest purchase decision you're ever going to make. How many of you could do it twice or even 1.5 times? So that enters into the discussion I have with my patients is, okay, so we've got 6 or 12 teeth. Let's say they last 10 years. You spend the tens of thousands this year. Are you going to be able to do it again in 5 to 10 years? Because as I was alluding to, there's a financial event that happens in many people's lives that allows them to do something like this. Some people may go out and buy a $50,000 Rolex. Some people may go out and buy a boat or a sports car, whatever, second house. But many people, whether it's inheritance, it's retirement, it's some financial event happens and you want to fix your teeth. Well, this is where it becomes maybe a one-time thing. So for those of you who are in that boat, we tend to be a little bit more aggressive about taking teeth out because the likelihood of an implant being here decades later is much higher than the likelihood of a stray tooth or 3 or 6 being here a few decades later. So where is that tipping point? I mean, that's why you're tuned in and that's why you're still listening. And the tipping point, unfortunately, is different for every patient. I'll tell you how the math on a diagnostic rubric works here in a little bit. But the tipping point's different for every patient. And maybe, like I just mentioned, maybe that tipping point is the money part. You have money to do this right now once. And if that's the case, you got to do months of research before you make your decision. But let's talk about the philosophical. Again, I mentioned it just a few seconds ago. Can you do this twice? If the answer is yes, absolutely. Save every, even marginal tooth if you want, unless it gets in the way of treatment. If you can do it more than once, those are easy decisions, right? And we'll expand upon this in a little bit. But that's how the fair approach is between doctor and patient. In a full scope practice like you'll find here at the Dental Implant Center or at an ethical, honest practice anywhere, I don't care what decision you make. I'm not going to pressure you into one thing that might make me more money or pressure you into something that I feel like maybe is easier for me. I'm going to give you your options. We're going to talk about the pros and the cons, and we're going to work together on making a decision. That's what you should expect everywhere. If you're in an office that keeps pushing one treatment and one treatment only, and they want to keep you there for hours talking about it, run. So, if you're a candidate to save some, most, or all of your teeth, consider these following questions. Or statements, maybe. Teeth do only get worse over time. Like I said about that quote, our job as dentists is to make the tooth fail as slowly as possible. Teeth only get worse over time. I wish it wasn't like that, but it is. So that plays into it, knowing that where you are today, your teeth are going to be worse in 10 years. How motivated are you to follow recommendations and change your habits? Your home care, your night guards, your follow-ups. Will you be compliant? Will you do what we ask you to do? And let's just use history as an indicator. If you have a long history of falling asleep before you can brush your teeth, you have a long history of getting night guards and not wearing them, if you get bad exams at most of your dental visits, those are indicators that you're probably not going to change. Because if you were going to change, you've had decades to do that. Human nature. No judgment here, just human nature. Who does your work matters. The average lifespan of a crown in the United States is 9.5 years. Insurances cover crown replacement every 7 years. So what does this slide mean? Most dental work's going to fail. But who does your work matters, because somebody who cares about outcomes, who uses a lab that does good work, this number can turn into 30 years very easily just based on the mindset and the practice's philosophy. Dry mouth, and I talked about this twice already. 2,000 medications, probably more than that now, are known to cause dry mouth. Regular normal aging causes dry mouth. With each subsequent decade, usually over the age of 50, our salivary volume and viscosity changes, and it never changes for the better. Clenching and grinding. It's one of the biggest nemesises in all of dentistry. We can literally build the most perfect castle, and this is an earthquake. And this is something that has to be controlled from during treatment all the way through the rest of your life. So teeth get weaker with each dental procedure. Implants can actually be stronger and more wear resistant than natural teeth. So there are nuances about this, but clenchers and grinders, you don't give us, the prognosis for you guys goes down a lot, especially if you're not compliant. A simple little cheap or free mouth guard. Best insurance policy you will ever buy. So I want to summarize kind of what we've talked about and just go through it one last time. Give you some real world examples that might help you understand why this decision is so paramount. Dental exhaustion happens. And I want to point you to buying a car, going to a dealership, get there Saturday at 10 o'clock. They are going to steal as many hours of your life as they can. They want to exhaust you. They want to make sure that you're not going to the dealership next door the next day or the next weekend. They are going to wear you down. And I know that that's how you guys, many of you feel about where you are right now in your dental status, is that you've been researching, you've been watching YouTube videos. You think you've got some good teeth, but you're not sure. One office told you that you didn't. One office said maybe they could be saved, maybe a few things in between. But you're going to be very exhausted by considering the time and the cost of this. There is a human habit that I became aware of thanks to my good friend Barbara. I tend to be impatient and impulsive. I'll research stuff to a certain degree, and then, like all of you, I get to the point where I just don't want to think about it anymore. And it's hard to push through, and you're like, okay, I'm going to buy that because that seems like the best. But there's actually what occurs is called decision fatigue, where you fret over something or you research something so long that you finally just can't make a good decision anymore, and you're going to jump at an impulse. And this is what I'm trying to really prevent you all from doing, is getting so overwhelmed by the process that you can't continue to research it. So if you start going to free consultations and you start getting all these different opinions, many of these offices are going to keep you there, trying to get financing for you, trying to wear you down, trying to get you to sign on the dotted line. So I would just encourage you, do more of this type of research. Make sure you know all your options the best that you can, so that when you do finally go for a consultation, you're the one in charge of the consultation. You're asking the questions. You're asking them to show you proof of their work. You're not just sitting there like a zombie taking all this information in, where most of it could actually be false. So in closing, I am aware of what's called a diagnostic rubric. It's more of a scientific approach to figuring out where your teeth lie on that scale of save them, extract them, and in between. So for those of you who want to dive a little deeper, this is by no means an end-all be-all. You're going to calculate your score. It's going to put you in a range, but at least it arms you with a little bit more information than you had before you saw this. So across the top is the scoring system. Down the columns is what you're evaluating. So we've got how many teeth are you missing? What's your periodontal status? The severity of your decay? The previous dental work that may be failing? Is your mouth dry or not? Do you smoke? What's your home care and what could it be? Then across here, you're going to score yourself based on these descriptions. So as you go through each category, number of missing teeth, 0 to 2, 3 to 5, 5 or more, and the points associated with it. You actually have an opportunity to get a 1 on a perfect mouth. A terrible mouth would be an 18. So it's far from perfect, but at least it gives you a starting point, something to arm yourself with at a consultation so that you have at least a little bit of a head start. So the way it works is you add up your score in that far column, and if you score below 7, you probably have a chance to save some of your teeth. Between 8 and 11, it's optional. You could keep them based on the other factors we talked about. And anything 12 or over, the chances of it working out well are very, very low. But I wanted to give you my opinion. the emotional approach, the philosophical approach, but also a mathematical one that might help you, go down the rabbit hole a little further and feel better when you go into a consultation. So thank you so much. Appreciate you listening as always.